The views and opinions expressed in the following program are those of the participants and do not necessarily reflect those of KSMQ Public Service Media Incorporated or its assigns.
September is Brain Aneurysm Month. Brain aneurysms affect over 6 million Americans. Stay tuned with Health Connections to learn more. Good evening, I'm Sean Riley and you're watching Health Connections. September is Brain Aneurysm Month. Brain aneurysms affect over 6 million Americans today. Tonight I have the pleasure of having a guest with us who is Dr. Robert Brown, Chair of Neurology for Mayo Clinic Rochester. Dr. Brown, an expert in the side of brain aneurysms, and I'd like to thank you and welcome to the show.
Thank
Doctor.
you. Great to be here with you.
So Doctor, what exactly are brain aneurysms?
Well, an aneurysm is a small balloon or sac, a little bubble that forms on an artery in the brain. An artery is a little tiny hose, if you will, that supplies the blood to the brain tissue. And so again, an aneurysm is a little balloon-like outpouching that forms off the side of an artery.
So how do people get something like this? Is this an affliction that you get from having too much fish or genetic? Or?
Yeah, it's a good question. Aneurysms typically are acquired, meaning they come on during one's adult life. Very unusual in children. Typically start to occur between the ages of 30 to 50, but would be the most common, but certainly can occur in older people as well. But in terms of your question regarding why do brain aneurysms form, very often there's no specific factor that led to a brain aneurysm forming. However, cigarette smoking and high blood pressure are both very important factors that increase the risk of an aneurysm forming. In addition, there is a genetic aspect to it. In other words, about 20% or so of aneurysms we see run in families. And so there will be brothers and sisters will be affected, or a parent and their adult age child will be affected. So genes do play a role in about 20%, but I really want to emphasize the importance of high blood pressure and cigarette smoking in aneurysm formation.
So it's a combination of both genetic and environmental effects for it. So is there one cause or the other that seems more likely that people would come out with an aneurysm? Is it more likely that if they have a genetic past? Or?
Yeah. Well, only about 20% of aneurysms we see have a genetic cause or a strong genetic influence. And so that means about 80% of people we see with brain aneurysms, they don't describe any family history at all. Some of those people will say that they had a history of high blood pressure or a history of cigarette smoking. But here again, there are many people who have no cigarette smoking history or high blood pressure, no family history, but they develop a brain aneurysm. There are also certain medical disorders. One that your viewers may have heard of before is a kidney disease called polycystic kidney disease. And that can run in families, and that particular disorder is associated with an increased occurrence of brain aneurysms for reasons that aren't exactly clear, but nonetheless, that disorder is associated with brain aneurysms. And there are several other medical disorders that are associated with an increased occurrence of brain aneurysms. So you can see that brain aneurysms, a complex entity. It can occur both in people who don't have any particular medical factor or prior risk factor that would have led to it forming, others that may have a family history, and still others who have one of these medical disorders associated with an increased occurrence of brain aneurysm.
So if you have an aneurysm, what kind of risk factors are you looking at? I mean, what is the effect?
Well, oftentimes we detect a brain aneurysm on a CAT scan of a head, that is a fancy picture of the brain tissue, or an MRI scan, another very fancy picture of the brain tissue. And CT scans and MRI scans are done now for all sorts of symptoms, whether it be headache or somebody got in a motor vehicle accident, they have dizziness, they have tingling or numbness on one side of the body. Many, many different symptoms can lead to a CAT scan or MRI scan. And so it's not unusual that we find an MRI or find an aneurysm on the MRI scan or CAT scan done for complete other reasons, completely unrelated to the aneurysm. And that's what is contributing to our finding that about 2% of the population have a brain aneurysm. As you alluded to in the introduction, fully 6 million people in the United States alone have a brain aneurysm. And so the great proportion of them are detected on a scan of the head done for reasons completely unrelated to the brain aneurysm. Still other people, the aneurysm can get to be large enough that it can push on some brain structures and cause symptoms. And in a small proportion of people, they will have an aneurysm rupture. Imagine a balloon that has gotten too much air into it and pops. Well, that's what happens when an aneurysm ruptures, and that leads to blood spilling into the brain tissue, causing a very sudden, severe headache. And people oftentimes describe it as a headache unlike anything they've ever had in their life. It's like somebody literally took a baseball bat and hit them over the head, just like a lightning bolt, sudden, severe headache. And that's called a hemorrhage, subarachnoid hemorrhage in particular. It's a certain type of stroke that can occur. Only about 5 to 10% of strokes are caused by brain aneurysm rupture. So it gives you some idea that this particular type of hemorrhage is fortunately relatively uncommon, because it's very serious when it occurs.
So you mentioned the splitting headache instantaneously. Does that persist? And what are some of the other aspects a patient might expect to feel if they're afflicted with an aneurysm?
Well, it is a headache that typically does then persist. That is, it doesn't just come and go within seconds to minutes. It'll remain, and typically will remain quite severe, oftentimes for several hours or oftentimes even for days. But some people who have had a bleed from an aneurysm, they'll have a headache, but it will not be so marked, not so severe. And those are people that'll sometimes come to an emergency department and say, you know, I have this headache. It's unusual for me. I haven't had a headache like this before, and I think it came on quite suddenly. And medical examination will be done, and nothing will be found. And so sometimes those people go home, and then we'll have another hemorrhage a day or 2 or 3 later. That is, headaches are very common in all people, and so the headache of an aneurysm can sometimes mimic headaches of virus or some other more benign causes of headache. But going back for a moment, certainly if one of our viewers were to have a sudden, severe lightning bolt type of a headache, that is something that they should see a healthcare provider for very, very quickly, and particularly if it's unlike any headache that they've had before. That's the important factor. You know, I had mentioned a couple minutes ago that sometimes aneurysms can grow just to a large enough size that it can push on some other part of the brain and cause symptoms. And that can sometimes lead to vision loss or double vision, can sometimes lead to weakness on one side of the body, sometimes a seizure. And so if an aneurysm does get to be large enough to push on some areas of the brain tissue, it can cause other symptoms, but that's actually quite unusual. So it's really the sudden severe headache is one potential presentation for an aneurysm, but far and away the most common presentation would be without any symptoms at all, that we just happen to detect it on a CAT scan or MRI scan.
So it's actually kind of interesting. My sister was in the ED in the last couple of weeks, actually, with symptoms very similar to what you're describing. She had a very sudden headache, rarely ever gets it, very intense headache, and she went into the ER actually in St. Mary's. And as a patient, if you have that experience, should you be asking for a CT or MRI? Is that something that physicians will do automatically, or?
Yeah. Well, it's an excellent question, and certainly if the headache is severe, sudden in onset, unlike any headache a person has had before, the healthcare provider in the emergency setting will do a good history, listening to what the headache was like, and do a clinical examination, a physical examination. But oftentimes that would be followed by a CAT scan of the head to try to detect any evidence of bleeding, hemorrhage in the brain tissue. And a CAT scan is quite sensitive. That is, it's very able to pick up blood in the brain tissue. And then sometimes if the headache is very, very severe, but yet the CAT scan doesn't show anything, sometimes what's called a spinal tap, a spinal fluid examination, will be performed in the emergency setting. Here again, it's to try to rule out any evidence of bleeding.
So do aneurysms only happen in the brain, or do they happen in any other parts of the body?
It's a good question. The type of aneurysms we're talking about right now, a saccular aneurysm, the most common site for that, a saccular aneurysm meaning the little bubble or sac that we were referring to earlier, the most common site for that is in the brain. It's actually quite uncommon for that type of aneurysm to occur elsewhere in the body. However, there are other aneurysms that occur in the arteries elsewhere in the body. One of the more common is in what's called the abdominal aorta, a huge artery in our abdomen that leads the blood to go down to the kidneys, other organs in the abdomen, and down into the legs as well. And that particular artery, again, it's called the aorta, it's a big, big artery in the belly, in the abdomen, can sometimes form an aneurysm, a bulge in the size, in the side of that particular artery. It doesn't form a little sac or a balloon, but instead it's kind of a diffuse bulging of that artery. So that is certainly a type of aneurysm that's relatively common, and many of your viewers may well have heard of that type of aneurysm before as well.
So with aneurysms primarily being in the brain, how is it that they're related to strokes, and how would someone, from maybe a patient's perspective, how would they know the difference, or would they know the difference?
Yeah, well, great question, and it's important for us to step back and consider, what is a stroke? Well, about 85% to 90%, that is 9 out of 10 strokes that we see, are caused by a blockage in an artery, leading to a lack of blood supply to the brain tissue, and then the brain tissue starts to die off because of that lack of oxygen-carrying blood going up to the brain. Only about 10 to 15% of strokes are caused by bleeding into the brain, and then taking it one step further, only overall about 5% of strokes are caused by a bleeding aneurysm. So again, just to think through that further, there are two main types of stroke. The one in which there's a lack of blood supply, called an ischemic stroke, and that's far and away the most common. And then there's the bleeding or hemorrhagic type of stroke, far less common, about 10 to 15%, and that's where aneurysms play a role.
So what is the treatment? Where do we go if you've got an aneurysm? I mean, is it brain surgery time, or is there medication, or what are the treatments?
Well, if an aneurysm is detected on a CAT scan or MRI scan done for complete other reasons, that is, it's not related to any specific symptoms from the aneurysm, then we step back and consider a whole number of factors, including the patient's medical history, what is their overall health, what is their age, what is the size, location, and appearance of the aneurysm. We'll talk more about that in a moment. There are many different factors that contribute to the decision regarding whether the aneurysm should be left alone or whether the aneurysm should be treated. You know, we do know that because about 6 million people in the United States have a brain aneurysm, but only about 20 to 25,000 have an aneurysm rupture, an aneurysm bleeding in any year. It means that most aneurysms don't cause hemorrhage, don't cause any symptoms at all. So this is a situation in which, as a healthcare provider, we will carefully consider what is the risk of that aneurysm bleeding over the course of time. We'll sit down with the patient and we'll talk through what is the risk if we were to leave this aneurysm alone and follow it over time with a repeat CAT scan or repeat MRI scan and just monitor you. What would be the risk of that aneurysm bleeding during any given year? And then we compare that to the risk of doing something to it. And there are several options for treatment, and we combine the decision from a neurology standpoint with our neurosurgery and neuroradiology colleagues, and so compare those risks, and then the patient can make that decision. But again, there are many different factors, both based on the patient and his or her health, and also based on the aneurysm, because aneurysms of different sizes and locations and appearances have different risks of bleeding over the course of time.
So this is a pretty complex protocol. I mean, in most people will think of medicine. In this case, they'll think of family medicine, and I have the flu, thus I take this drug and off I go. And in this case, it seems like this is much more objective, and you have to spend just infinitely more time really assessing the situation. How is that research done, and who is it who's out there that's determining those protocols, setting those standards for physicians in this space?
Well, and thank you for asking that question, but you are exactly right. After the aneurysm is initially detected, oftentimes additional scans are performed, different types of CAT scans or MRI scans to look at the aneurysm in detail so that we can better characterize what is the risk of bleeding over the course of time. The research that is being done right now is oftentimes funded by the National Institutes of Health, which is a federal government research organization, and they help to fund very large studies to try to determine, here again, which aneurysm should be treated and which aneurysm should be left alone. And of those that are left alone, how should they be monitored over time? So there is a tremendous amount of research that is occurring both at the Mayo Clinic and at other institutions nationwide and really worldwide that are assessing this particular issue. You had asked a moment ago regarding what about the treatments, and I want to make sure we do talk through those a bit, if I may. When we see an aneurysm, and if we determine in collaboration with our neurosurgery and neuroradiology colleagues and in careful discussion with our patients that something needs to be done to that aneurysm, then there are several options for treating that aneurysm. And those include actual brain surgery, as you mentioned earlier, a brain surgery in which a neurosurgeon takes off part of the skull, the bone that overlies our brain tissue, takes off a part of the skull and goes in and puts a little tiny metallic clip across the bottom of that aneurysm and cures it in that way by essentially blocking it off from its blood flow. And then there's another type of treatment that's performed either by a neuroradiologist or a neurosurgeon that's treating the aneurysm from inside the artery. And you might be thinking, now, how would we do that? Well, what happens in that context is a small little plastic tube called a catheter is placed in an artery in the groin, down where the leg attaches to the rest of the body. And that little plastic catheter is placed right at that site and is advanced all the way up into the brain tissue, all the way into the aneurysm. That catheter can weave its way all the way up into the brain tissue.
So it travels the entire abdomen and all the way up.
Exactly. Travels up through the big artery in the abdomen and up through the neck and up into the brain tissue. And that little plastic catheter can then be advanced all the way into the aneurysm, and a tiny coil, a little pigtail, if you will, is placed in, or several of these little coils are placed in the aneurysm, plugging up the aneurysm, which is again just a little balloon or a little sac. And so these coils can be placed in the aneurysm, plugging the aneurysm in that way and curing the aneurysm in that way. So that is increasingly the direction that we will take when we determine that an aneurysm needs to be treated.
It sounds very much like cardiac surgery, just kind of the other direction. Instead of cleansing out the artery, that you're actually almost putting the tube inside the tube to block off the aneurysm.
Yeah, you know, that's a perfect analogy, Sean, because the procedure of putting in the catheter and advancing it up into the arteries, it's very similar to what our cardiology colleagues will do for the heart arteries. But in this circumstance, just like you mentioned, we're advancing the catheter up into the brain arteries rather than into the heart arteries, and we then direct it all the way into the aneurysm. And in further comment to your question that you just made, sometimes we do treat narrowings in the neck arteries or brain arteries in the same way that our cardiology colleagues treat the heart arteries with stents and balloons. But this is a whole different issue when you're treating an aneurysm.
So how long does a procedure like that take? What kind of recovery times is a patient looking for? It sounds like something that wouldn't be fast.
Well, it actually depends on whether the patient has presented with bleeding from the aneurysm. If they've had a hemorrhage, a bleeding from that aneurysm, then that is a very, very serious situation, and we try to have our neuroradiology and neurosurgery colleagues treat that aneurysm in an emergency situation to try to prevent another aneurysm, or another bleeding, I should say, from occurring. So in that situation, the decision is quite clear that we need to try to treat that aneurysm if at all possible. And that differs from the situation in which we find the aneurysm on a scan for reasons completely unrelated to bleeding, where we have the ability to think about whether the aneurysm needs to be treated or not. So in terms of recovery time, if the aneurysm has ruptured, has caused a bleeding, the recovery time often depends on just how severe was that bleeding episode. And some of our patients who've had that type of hemorrhage will be in our hospital for several days, sometimes even several weeks or longer, because this can be an extremely serious type of stroke. And so sometimes it is of such a severity that a person will be in the hospital for several weeks. Sadly, even with the most advanced medical care, when an aneurysm ruptures, some people die from aneurysm rupture, and that is one of the factors that helps to drive us all in our aneurysm research to try and define who should be treated, who should be left alone, and if the aneurysm is treated, what's the best way of treating it. Now, if an aneurysm, though, is detected prior to rupture, and if the decision is made to treat that aneurysm, oftentimes those people may only be in the hospital for a day or two, and then will be free to go home.
You mentioned that people aren't always going to come through this, even when they're in the best of hands. And now here in our region, I mean, we're Mayo Clinic facilities in all areas, and you know, one of the world-renowned areas here. If you're in a facility or rural health care, or maybe just somewhere that simply doesn't have a neurologist nearby, what are the likelihoods that people are going to have adverse events from aneurysms? And maybe the other side of that is what should people like that be doing to prevent aneurysms? You mentioned smoking, but
yeah. Well, in terms of your initial question, certainly in rural America, if somebody were to present with this sudden severe headache, many of those hospitals do have CAT scans available so that an initial scan might be performed there, and if a hemorrhage was detected, whether it be via ground ambulance, or this would be an example where air-based ambulance would oftentimes take that patient to the nearest medical center that specializes in brain aneurysms, just because, as you alluded to a moment ago, it is the type of very complex medical disorder that you would want to have the critical care neurology physicians, neurosurgeons, neuroradiologists, and other physicians available to provide the best care. Now, you also asked the question, though, as a correlate to that, what about prevention? And it does tie into the general good health, that is in terms of blood pressure, cigarette smoking. Certainly, it is the case that people can lessen their risk of having aneurysm formation or stroke overall by avoiding cigarette smoking, and if they are a cigarette smoker, to do everything they can in working with their healthcare provider to quit smoking. And likewise, to know their blood pressure, and if it is elevated, to treat it, to try to bring it down. It ends up that those factors that we'll sometimes talk about in relation to stroke and heart disease, those two factors are the same ones that can promote aneurysm formation. Diabetes and high cholesterol, not so important actually for aneurysm formation. They're important for heart disease and stroke, certainly, but not as important, certainly, for aneurysm formation.
Mm-hmm. So that correlation actually gets to be really important for people when it comes to things like blood pressure, and if they've got different chronic diseases that may impact that. Is there kind of a formula that you look at for impact of diseases that would make it more likely to have an aneurysm? Or is...
Yeah, you know, it's a good question, and particularly in people who have a family history of aneurysm, particularly if they're cigarette smokers or have high blood pressure, and if they have a family history, their risk of having an aneurysm form during their life is actually quite high. In a research study that we worked on at Mayo Clinic in Rochester, we found that in that situation, about 20% of those family members, that is, if there is a family history in two or more relatives, 20% of the relatives may end up with, or I should say it this way, if you are a relative of somebody who's been affected with aneurysm, your chance of having an aneurysm during life is 20%, which is a very high risk. For the rest of people, though, who don't have any family history, the risk is low enough that we really don't perform screening studies for people in that context. There's no specific reason to do an MRI or a CAT scan looking ahead of time for a brain aneurysm.
Well, Dr. Brown, thank you very much for coming on the show tonight. We're coming to the end of our time together, but definitely a very interesting subject, and I'd love to talk more about the procedures at some point.
So, look forward to it.
So, but ladies and gentlemen, thank you for watching Health Connections tonight, and for more information on brain aneurysms, go out to Google and do some searching. Otherwise, go out to mayoclinic.org or other sites that you can find information. And, again, Dr. Brown, thank you very much.
Thank you for inviting me.
Thanks.